Hello everyone, I'm Mary Claire Trues and I'll be presenting the dengue fever. It was on 1635 when it was first suspected that a dengue-like epidemic occurred. However, it was on 1780 that dengue fever was clearly defined by Benjamin Rush. 1828, an epidemic occurred in Cuba that caused the disease to be called dengue, but was later on changed to dengue. Sporadic outbreaks also occurred in New Orleans that affected 40,000 people in 1873. Around 1879 to 1880, epidemic in southern U.S. port cities occurred. Then vaccine was licensed on December 2015 in Mexico. So what is dengue fever? Dengue is an acute febrile disease caused by mosquito-borne viruses consisting of 4 serotypes. All 4 serotypes emerged from sylvatic strains in the forests of Southeast Asia. Formal name is dengue fever. Common name is breakbone fever because of its intense bone and joint pain that accompanies the disease. Also known as 7-day fever because of its symptoms usually last for a 7-day period. Also known as dengue fever amongst the black West Indian slaves in 1827. It's an arthropod-borne viral disease belonging in the group 4 Baltimore classification system as a positive single-strand RNA belonging in the family Flaviridae that consists of the flavivirus, pestivirus, hepativirus. It belongs to the genus Flavivirus and species dengue virus. 4 serotypes include DEN1, DEN2, DEN3, DEN4. If you were to be infected by one, you can only build up immunity against that one virus serotype, and the rest you have to acquire by getting them. Some characteristics of the dengue virus is that it's single-stranded RNA that's packaged within a capsid protein. It has 180 copies of 2 glycoproteins and has a complete virion that's around 15 nanometers in diameter. It's spherical in shape. On the picture, A shows the mature dengue particle, which has the spikes that jut out from its surface. B shows the mature dengue virus, which has a smooth surface. Its membrane is enclosed by a protein shell. Dengue viruses cause the most common arthropod-borne viral disease in man. As you can see here, we have symptomatic and asymptomatic. 2/3 of the population, I believe, was written in the CDC report, that are infected by the dengue virus. Some that are symptomatic get the dengue fever, also get the more severe case of the dengue fever, which is the dengue hemorrhagic fever that causes a plasma leak syndrome. And then the more severe case is the dengue shock syndrome. Pathogenesis. Pathogenesis first occurs when the mosquito, which is the vector, typically an Aedes mosquito, Aedes aegypti mosquito, to be more exact, punctures your skin, your epidermis, and into your dermis, releasing the dengue virus through its saliva. The dengue virus then infects the macrophage and the dendritic cells by binding to its receptors, the DC sign and the mannose receptors. These infected macrophage and DC cells move to the lymphatic vessels, while the others that are left in the dermis release interferon that acts as a cytotoxic alarm that brings the natural killer cells and then the cytotoxic T cells from the capillaries to come out and produce an inflammatory response. The ones that actually go to the lymph node cause the dengue virus to spread to the system in circulation. It also causes viremia that creates this plasma leak and eventually causes a more severe case of the dengue fever, which is the dengue hemorrhagic fever. Life cycle. The virion first binds to cell surface attachment molecules and receptors via endocytosis. Then second, it disassembles the virion and releases the viral RNA into the cytoplasm. Viral RNA is translated into a polyprotein, and viral protein replicates the genome RNA. Virus is assembled in the plasmic reticulum. Immature particles are transported through the secretory pathway, where furin-mediated cleavage of ERM drives maturation of the virus, and then mature virus is then released from the cell. Transmission occurs through perinatal transmission, that's through microtransfusion when mucosal and blood contact occurs between the infected mother and passed on to the child. Also includes breastfeeding. The virus gets transferred via breast milk. Blood-borne transmission occurs when, for example, organ transplant. That's when you get infected tissues from the person that's infected of the dengue virus. For vectors, are usually the Aedes mosquito, mainly the Aedes aegypti. That's more susceptible to the dengue virus. So when a person that's infected of the dengue virus is bitten by a mosquito, the mosquito carries that virus with it for the rest of its life, and then bites another person that's healthy, and by that time that mosquito infects the other person. Symptoms and warnings. So dengue fever and dengue hemorrhagic fever symptoms are sometimes indistinguishable, but DHF associated with hemorrhagic manifestation, plasma leakage because of increased permeability. Principal symptoms of dengue are high fever and at least two of the following: this severe headache, pain behind the eyes, joint pain, muscle pain, rash, mild bleeding, low white cell count. You also have to watch for warning signs after fever has declined or temperature has declined for approximately around 3 to 5 days after symptoms start. Presence of one or more of these warning signs indicate that you should seek medical evaluation. So abdominal pain, red spots, bleeding, vomiting, black stools, drowsiness, clammy skin, pale or cold, difficulty breathing are the warning signs. Preventative strategies include vaccination. As I mentioned before, vaccine was licensed on December 2015 in Mexico. Invaxia is the first dengue vaccine made by the Sanofi Pasteur. The vaccine is used in endemic areas right now. Vaccine shown in clinical trial, though, to be effective for seropositive individuals and dangerous for seronegative individuals, and will increase their risk of severe dengue if they were to get a natural infection after the vaccination. So pre-vaccinated screening is required. Mosquito repellents are also preventive strategies for dengue. Mainly, you should get mosquito repellents that has DEET, oil of lemon, eucalyptus, picaridin, IR3535, and some spatial repellent are mosquito coils. You also need to get rid of freestanding water, such as jars, wheelbarrows, anything, some sort of artificial containers that will enable freestanding water to occur, and because that's where female mosquitoes like to lay their eggs, since water is a requirement for laying mosquito eggs. Here are some frequent or continuous at-risk areas. Here we have it here. We have it here too, in Yemen, Kenya. Here is Southeast Asia, mainly. Huge. This is actually from a result 3 months ago. So this is a more current view of the dengue infection. Dengue is a very infectious disease affecting 50 to 100 million people each year. 50,000 500,000 develops dengue hemorrhagic fever. That's when it's actually required to be hospitalized. Once it worsens, it's gonna turn into the dengue shock syndrome, or the DSS, where it's gonna be fatal, and it's gonna be fatality is approximately around 1 to 1.5%. But then once treatment is not good, then that's when it increases to 20%. And also it causes 20,000 deaths per year. There's actually no treatment for dengue. If you think you have dengue, or it's better to go to a doctor. Also stay hydrated, avoid aspirins or anticoagulants, because you would want your blood to coagulate. Also, to reduce the fever, you can also take acetaminophen, and also like tepid sponge bath, or like lukewarm sponge bath. You should go to the hospital at most. And that's it.